Hey everyone, welcome to our Q&A by me, Dr. Karina Kibsey. I'm a naturopathic doctor with a special focus on digestive health and have been working in naturopathic medicine for over 5 years. Today, I will be answering your prostate health questions. If you like this video, please don't forget to like and subscribe to our channel. Let's get to it. This question is from James. I get a lower backache when walking. I assume this is caused by the prostate. Is that a sign of it getting worse? Okay, so this is definitely something that you should bring up to your doctor. Back pain isn't a typical symptom of BPH. However, if someone has prostate cancer, it can spread to the bones and cause back pain. Your doctor might run imaging like an X-ray, CT scan, or MRI to see if there is any cancer in the bone. And if you don't have prostate cancer, then there are many other reasons that you might have back pain. So it could be musculoskeletal in origin, it could be coming from a degenerating disc and pressure on your spinal nerves. It could also be a symptom of kidney stones. It could even be resulting from a sprain, strain, or overexertion injury. So definitely speak to your healthcare provider so that they can do a full assessment and any imaging that might be needed. Next question. The treatment to reduce the size of an enlarged prostate has a negative side effect. It tends to reduce sexual power or render one impotent. What should one do to regain erection? Isaac. So in naturopathic medicine, our main guiding principle is all about treating the root cause. So if the cause of impotency is a medication, then you'll want to treat the condition that you're taking the medication for. So in this case, that's BPH. Consider seeking natural treatment for BPH, and some good options to talk to your healthcare provider about are saw palmetto, pygeum, and beta-cytosterols. Question 3. I have read that eating eggs is not good for the prostate. What are your thoughts on that? That's from Kenneth. There is research to show that consuming eggs can increase the risk of recurrence or progression to prostate cancer. So if you're at higher risk of prostate cancer, then I would recommend you avoiding eggs in the diet. Question 4. Can you tell me a vegetarian diet that would be beneficial against CPPS and also an alternative for wheat? From Gaurav. Well, you can certainly eat a diet that is beneficial against CPPS that is also vegetarian. So you'll want to consume lots of cruciferous vegetables, and you can also eat lots of fruit, but avoid citrus fruits because they are more acidic. Eating lots of nuts and seeds is good for their zinc content, and foods that are high in fiber can be helpful too. So if you're looking for an alternative to wheat, there are lots of other grains out there that you can consume, like rice, quinoa, and oats. Question 5. Is a biopsy needed for cancer detection? Edmundo. Yes, a biopsy is needed in order to confirm a cancer diagnosis. However, the first steps include a PSA level test and a digital rectal examination. If these come back clear, then you might not need a biopsy at all. Question 6. Are there any herbs for the cure of prostate enlargement? Charles. Yes, there are some great herbs that can help to treat an enlarged prostate. So one of those that I use the most often in my practice is saw palmetto. And another one of my go-tos for treating an enlarged prostate is called Pygeum africanum. Stinging nettle is another herb that can help, but only if it's used along with saw palmetto. Next question. I would be interested in more information about the research on the effect of cycling on the prostate. That's from David. Well, there are several studies showing that cycling can falsely elevate your PSA level. This is thought to be because of the manipulation of the prostate that occurs while riding on a bicycle seat. Question 7. How can I lower my PSA level? J. Scott. There are a few things that you can do to lower your PSA level. One is, as I mentioned, taking saw palmetto, and another is taking a selenium supplement. But rather than taking a supplement for selenium, you can actually just increase your intake of Brazil nuts since they're full of selenium. And you can also take a lycopene supplement, but again, you can do this through the diet by increasing your intake of tomatoes. So when it comes to tomatoes, the more processed they are, the more absorbable the lycopene is. So you'll actually want cooked tomatoes and tomato sauce over the whole raw tomatoes. Question 8. How high can the PSA get before you should start to worry? R. Henderson. All right, so this is going to depend upon your age. If you're in your 40s or 50s, then anything above 2.5 is considered abnormal. But if you're in your 60s, then a PSA above 4.0 is what is considered higher than the normal healthy range. And at any age, if your PSA does go up by more than 0.35 within a year, then that could be concerning. Question 9. How does having BPH lessen urine streams? Joe. Your urethra is the tube that carries urine from your bladder to your penis. But first, the urethra passes through the prostate. So if your prostate is enlarged, then it can constrict the urethra. This is why you can have a weaker urine stream if you have BPH. Question 10. I had my prostate removed. What can I do to help with incontinence and erection problems? Edward. The most common type of incontinence that people experience after a prostate removal is called stress incontinence. This can be helped by doing exercises to strengthen your pelvic floor. You may have heard of these exercises before, called Kegel exercises. I would recommend seeing a pelvic physiotherapist who can prescribe exercises that would be helpful specifically for you. And when it comes to erection problems after prostate removal, this usually improves within a year after the surgery. And if you find that you're still having difficulty, this could be due to a lack of blood flow to the penis. In this case, you may want to ask your healthcare provider about taking ginkgo, which is a herb that increases blood circulation throughout the body. Thank you for sending in your questions, and I hope you find my answers useful. If anyone has any questions that need answering, please feel free to post in our comment box. Thanks for watching, and to see more of our videos, please click the subscribe button below.